I knew the body innately heals. It can't not.
A pocket of energy within myself.
This is for your mother. So just do this for her.
Let's figure out ways that we can actually use pleasure to come together and bring healing.
It's a modality where we go into your subconscious and change some of those limiting beliefs.
I'm Susan Marco, clinical hypnotist, and I have so many friends and people who have had big impact on my life. So I want to share them all with you. Hi, everybody. Susan Marco here, and welcome to Trance Talks, where, I have conversations with practitioners across multiple modalities, alternative disciplines, all that kind of stuff. And let me tell you today, excuse me, I am so excited to be able to sit here with Seth-Deborah, who I met a few years ago at the Hypnothoughts Live Hypnosis Conference in Las Vegas. And we connected and we hung out for the conference. And then the following year, we got to hang out together. And I just love you so much, Seth. And I think how you work and what you do is so freaking cool.
Oh, so thank you. I love you back. I love you.
Thank you. So before I hand the mic over to Seth, I just want to tell you, Seth-Deborah is a nurse anesthetist and a clinical hypnotherapist. She has a lot of accolades. She's a fellow with the National Board of Certified Clinical Hypnotherapists. She's an NGH hypnosis instructor. She's received multiple awards, and she's just an all-around wonderful person. So what I really want to do is hand the mic over to you, Seth, and just tell our listeners, what is it that you actually do? Like when we say medical hypnosis, what is that?
That's a great question. Medical hypnosis is using the mind to influence your physical body.
Yeah.
We all know that, for instance, when you get nervous and you're going to stand up in front of a class to give a speech, your hands sweat, you feel like you're going to upchuck. That is your emotions, your thoughts, right? Making for a physical reaction in your body into your little blood vessels, and it's all coming from, for simplicity's sake, from different neurotransmitters, just different biochemicals that your body makes on its own based upon your thoughts, your emotions.
Mm-hmm.
Okay, so we can influence those different biochemicals by our thoughts and our emotions. So if you would imagine standing in front of that class and having that anxiety, right, and your hands sweating 24 hours a day, year after year, can you imagine what those biochemicals are constantly eating away, destroying your capillaries, destroying all kinds of things within your body? And so, for instance, when a person is under stress constantly and not addressing that stress, their body breaks down in different ways, right? So medical hypnosis helps us to get in touch with our subconscious mind, our thoughts, our emotions, our feelings, and to make for different changes in even as simply as lifestyle, right? People with diabetes, just changing their lifestyle, getting up every morning and exercising, making sure that, they looked at the labels on their food and all that kind of stuff comes from the mental affecting the physical. I mean, you could go in different ways. For instance, how I got into this, people often ask me, okay?
Right.
So I'm a student nurse anesthetist, and I was trained in New York, in Brooklyn, with this wonderful 70-year, now to me that seems young. Oh my gosh. But anyway, she was 70 years old, Dr. Margaret Blumenfeld. And she came from Russia, was a general surgeon in China, and she was my anesthesiologist instructor. And we're doing a case. This is in downstate in Brooklyn, New York, right? And the mafia is real, has to do with this story. And this man got the mafia upset with him. And as he opened up the top of his garbage pail, a bomb blew, right? And so he had burns all over his face. And we were doing a skin graft from his leg to his face. And this is back in 1973 or 74. And at that time, we didn't have the drugs that we have now for IV hypnosis, anesthesia. Anyway, so we really couldn't put the mask on his face, and because his face was so burned, and the air is coming in on top of those days, I think we used halothane. So and on top of the halothane and the nitrous oxide that's coming in, just plain air is coming in. So he's not really falling asleep. And all I know is Dr. Blumenfeld just starts talking to him in his ear. And suddenly the guy puts his head to the side, sticks out his tongue, and he's zonked. He's out of it. And we did the skin graft from taking a piece of skin from his leg onto his face. And I just always thought it was just Dr. Blumenfeld. I didn't know she was using hypnosis. She would do this kind of stuff all the time.
Wow.
Yeah, and it was just her way, right? And so I guess I've inherited her way of addressing patients, right? It comes naturally to me as well, but I think maybe it started out because I modeled her. And then later on, in 2000, I got officially certified in it, and I've used it for pain control. I remember I was walking my husband and I were in this forest situation, and somebody comes out from the forest, help, my friend's fallen, right?
Yeah.
Anyway, I fell off his bicycle, hit his head on a rock. And also, as his teeth were coming out, they ripped his tongue and his lower lip. And he's bleeding and he's in pain. And I had just seen a DVD that Melissa Tears had shared with me, where they were in a dental school timing when they could stop blood. Someone had pierced the hand, and all blood stops in 3 to 5 minutes of clots, but they were timing with hypnosis, how fast they could do it. So my husband and I were checking his pupils, blah, 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 he's conscious and all that. And I said to him, I'm a hypnotist, I can help you. And so, before we did that, we took a T-shirt and we're putting it on his mouth, right? Trying to put pressure on the bleeding.
Yeah.
Problem is, he also broke his nose. So the nose is bleeding and getting bigger and bigger and bigger, and he can't breathe, right? So we took off the T-shirt, and so I said, okay, I'm a hypnotist, I can help you, let's stop the blood. And we thanked the blood for doing its job, for cleaning the wound. Now it's time to stop the bleeding, blah. And I used every image I could think of: capillaries closing, arteries closing, venous system shutting down. It was just like whatever I could think of. And my husband and I looked at the blood stopping.
Wow.
Now, Ken was a surgeon also, right? So both in the medical world. And we looked and the blood stopped. And I went, holy crap, this stuff works. And then I started working with his pain control, turning down the dial and so forth. So, I mean, it could be as dramatic as that. We utilize it for irritable bowel. They have used it for in vitro fertilization. They actually did tests in studies in Israel. And the success rate in using it while they were doing the implant was a 50% higher success rate getting pregnant.
Wow.
That's quite a bit. That's quite
high, yeah.
Yeah. And again, it has to do with your mental affecting the hormones you are putting out. and so forth, and all the different things. And so can work with that. One of my current passions is using it for pre-op patients, either working with them privately as like a client, people who are they're going to have heart surgery or knee surgery or even any regular, quote unquote, regular surgery, but they're very scared about it and nervous about it. And working with them ahead of time and releasing any mental blocks, like maybe they've had the surgery before and it hasn't gone well, or they've heard of people who've had the surgery. And that, releasing that block and imagining, visualizing success, ideally working with people 2 weeks before surgery or a month before surgery. However, just 11 weeks ago, I had a surgery myself. The year before that, I had a total knee surgery. And I'm listening to my own MP3 in the pre-op area and during the surgery itself. And I used hypnosis for the ups and downs of the surgeries, right? Because there were a lot of hiccups. I became allergic, and it's just things on some surgeries, and especially knee surgeries, any joint replacement. You have your ups and downs in physical therapy. That's when I start realizing this is a need out there. But 11 weeks ago, I was going to have my quote unquote female surgery. And I thought, okay, just an hour. 2 days before the surgery, they call me up, come in such and such a time, and we have 4 hours for you. I went, what? 4 hours? What are you talking about? It's an hour surgery. Evidently, it was going to be more than I anticipated, even though I work in surgery. It's when it comes to you, it's a whole different ballgame.
Yes.
I mean, so I knew he was going to do the ligaments and so forth, but I didn't really realize it was going to be a 4-hour surgery. And so I am in the pre-op area, scared. And the nurses there were wonderful as far as they did their job. They asked me all the right questions, but did they handle my anxiety? No way at all. My blood pressure is up to 165 over whatever it was. I'm scared. I'm nervous. I had an EKG the other, like beforehand. It was normal like 2 years ago, and now it has just a little PR interval increase. It's called first degree heart block. Not that big a deal. Most people have it as they're getting older, but I was worried about it, right? And I'm just lying there for an hour, plus I got nervous trying to find a parking spot and get there on time, blah, blah, blah. And no one is dealing with my anxiety. And even though I'm the wonderful hypnotist I am and know all about self-hypnosis, blah, 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 I know too much, right? I really know what could go wrong. And that's when I realized that finally the anesthesiologist, she was a lovely lady, and she actually came over and got some rapport with me. And I saw how much that meant to me, having that person care.
Yeah.
Really care. And so that is another area that I'm going into now. I'm going to be teaching nurses per se, different NLP hypnosis techniques, rapport techniques to use for people in the pre-op area, because it really, really is important.
Oh, I love that so much.
Yeah.
That is so needed.
It's so needed. And there are studies also out there from Harvard did a study that when you're more relaxed, you do better during surgery. You get home sooner. I think Blue Shield did a study on breast biopsy people. They actually did hypnosis in the pre-op area. Okay, so they didn't have any hypnosis beforehand, but just in the pre-op area. And they took less time during the surgery, took less medications, left earlier, and actually saved the hospital $700 per case.
Amazing.
Yeah. So there's really a need there. So I'm going to be working with that. And then I'm going to start really trying. let me change my words. You don't say try. I'm working on getting more private clientele to
Okay.
come to me beforehand. And then I would ideally eventually start going with people to the pre-op area. I've done that with some of my clients here locally, right? And going to the pre-op area when they're doing their IVs, when they're getting nervous and scared, and actually helping them if they need it.
Do you work with people via Zoom though? Yeah.
Yes, I do. Yeah.
Great.
Yeah.
Because
And
I know some of the people listening right now are going to be going, how do I get her? How do I connect with her?
yeah. And I tell people say, well, will Zoom work? And you go, well, when you're in hypnosis, you close your eyes. So do you really need to see me? And they go, oh. And then also because at some early in my career, I dabbled in stage hypnosis, right? So there are many convincers that you can use even on Zoom to convince a person that, yes, I'm under hypnosis, right?
Yes.
Their hands sticking to the chair and so forth.
Yes. Sure.
And yeah, so Zoom works great. It works really well. I'm working with a young gal now, 19 years old and bedwetting
Mm.
her whole life. 2 hypnosis sessions, and she's been dry for 3.5 weeks.
Well
Yeah.
done. Oh, how exciting is
I'm
that?
so proud. There's more to do because of the shame that was involved in that.
Sure.
But that's makes me feel useful, right? I've changed somebody's life.
Yeah.
Now that I'm older, I really want to change young people's lives.
I'm glad you said that because before we jumped on, we were talking about that you're adding something new into what you're doing.
Mm-hmm.
So tell us a little bit about that.
Well, I think it's because I came from such a crazy background that it took me a long time to thrive,
Mhm.
right? And if I had thrived earlier in my life, like in my 30s, instead of waiting until I'm 50,
Yeah.
40 at the time, um, things would have been different. Although I know that things happen for you to learn, right? It's not just that things happen to you. They're also, you have to use your mind. Okay, this happened to me, but how do I use this for me?
Yeah.
Right. And so, yeah, I'm at that point where I say things freely, sometimes unfiltered. For instance, like I'll make jokes in the OR, in the OR too, but sometimes the OR is a serious place, but like definitely in the pre-op place. If I see on Monday and Tuesday, I work at a pain management area. We're doing epidurals and injections into the vein, PRP injections. And sometimes I'll see a patient is really, really nervous. Their blood pressure is 177 or 195. We're even thinking of canceling the case. And you could just tell when somebody comes in that they're nervous. And so we always have to ask them their name and the procedure, right patient, right procedure. And so I'll say, so Mr. Smith, you're here for the vasectomy, right? And he'll look at me and he'll start laughing. And immediately his blood pressure goes down. So that kind of joking around and sometimes a little unfiltered.
Yeah.
And I just had a wonderful thing happen. Oh my gosh. So this week we had a patient come in for a little touch up. I had given him what I call the caring mommy lecture a year ago. He was here for some procedure and he was diabetic and his A1C was like above 7 and he was just not doing well. And you need to take off the weight for any back issues. I mean, the weight has to come off. No ifs, ands, or buts. And you got to get strong. And he just wasn't doing what he should have been doing. So I gave him the caring mommy lecture and he came back. His A1C was down to 6.1. He had lost, I think he said 40 pounds. He
Wow.
was mostly pain free. but he was just coming in for what he called the touch-up, and he no longer had high blood pressure.
Beautiful.
And it made me feel so good that I was able to affect someone's life
Yeah.
that way, right? And that's even without hypnosis. That's just with rapport and caring about them. And I didn't hold anything back. I said, what you do now is going to affect your life 20 years from now. If you don't do what I tell you to do, you'll be in the dialysis unit 4 hours a day, 4 hours 3 times a week, and all kinds of complications. And looking him in the eye and saying, you need to change. I don't remember exactly, but I really connect with people because I really care. Right?
Yeah.
The other two days a week right now, Thursday, Friday, I'm working in a angioplasty suite where we are basically ballooning arms for dialysis patients and legs. That's all we do. But it's all high blood pressure, overweight, and diabetes. I mean, you've got to take care of that and to take care of it sooner. And going back to medical hypnosis and using our mind. It's not about curing. Well, hypnosis doesn't cure the blood pressure. Hypnosis helps your mind
Right.
help your body.
Right.
Mm.
You know, I'm going to put you on the spot and ask you this question.
Okay.
What do you believe is the secret to success for your clients?
Whoa, I never thought of that.
Like, what does someone need to be able to succeed in a hypnotic
Interesting
process?
question. I think part of it comes on my pre-talk with them, letting them understand what hypnosis is, and also really telling them about brain plasticity and how repetition is important.
Yeah.
I also tell them about the physiology of when you're in hypnosis. There's the left and right hemisphere, and they're connected by something called the corpus callosum. And there's a natural body chemistry thing that happens of positive and negative charges going alternating in and out of the cell. So your cell is taking in food, your cell is giving out toxins, whatever you want. But there's this in and out all the time. When you're in hypnosis, that equalization of the positive and the negative is heightened. And so you're really physiologically more receptive to solutions, to suggestions, if you want the suggestion. If you don't want it, it doesn't get absorbed. So you really have to want it. And if you're not sure, then let's discover why you don't want it. What's going on that you're holding on to this old behavior, this old mechanism that is kind of destroying your life,
Yeah.
right? And so let's work on finding what's going on here, right? And so maybe that's it, that good pre-talk, so they really understand that this is real.
Yeah.
It's real. I'm just helping you get there. And also I explain about the brain waves changing, right? And that brain waves do different things. When you're asleep and you're going into theta brainwave, your body is in a literally healing condition. And they know this from people who don't sleep, right? So sleep is very important. And when we go into hypnosis, you could go deeply into trance, you're going into that theta brainwave right there, right? That's a great question.
Thank you.
Yeah. So yeah, it's a little bit about me making the success, pushing for the success to happen. And I guess as far as the client, it's the willingness to let go of old stuff.
Yes, ma'am.
Yeah, the willingness to let go of old stuff. That is time. It's time.
I love that. Thank you for taking the time to chat with me. So if people want to reach out to you, how would they contact you? This is all going to be in the show notes, but just in
Yeah.
case somebody's listening, and they want to jot it down, where's the best place for people to contact?
The best place is, my email. It's Seth-Deborah, no hyphen, SETHDEBORAH at hypnotherapyforhealth.com. They could also call. I'm usually in the OR with clients, so just leave a message, and that's 510-552-7576. And that's the best way to get me. And then my website, is hypnotherapyforhealth.com.
Beautiful.
Yeah.
Yeah. So, yeah, thanks again for taking the time. I love this conversation, and maybe we'll have to do a part 2.
Maybe. Thanks for inviting me.
There's always more to talk about, right?
Oh, yeah. Always want to talk about. Yeah. And then we'll talk about now the physiology of how memories change, not changing the memory, but the reaction to the memory. It's just
Yes.
it's new stuff, and it's just
Yeah,
fantastic.
well, that's all the neuroplasticity now that, we're learning about and talking about so much now, is that, how much more malleable the brain is than we ever thought.
Yes. Yes, 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 yeah. Even
And
when we're old, we can change.
that 100%.
Yeah, we still
long as
have
we're
billions
still
of
here.
neurons we haven't used yet, right?
Exactly. Well, on that note, thank you so much. And we'll see everybody on the next episode. Have a wonderful day, whatever you're up to. Make it a good one.
Bye.